Hi, I'm Dr. Brian Thornburg, and I wanted to address the growing popularity and recommendations from the mainstream medical community about starting high-risk allergen foods before 6 months old in your baby. I disagree with this as a general recommendation. I think that any kind of medical decision cannot be just applied to an entire population. There is much more nuances needed in order to act appropriately because babies are developing. The gut ecology, the way the gut functions, the way it protects itself, the immune system, everything around the gut is developing for the first 6 months of life. So if we're introducing a solid food before 6 months old, there is an increased chance of making more problems. That's why there is a board question, and it was on my pediatric board exam, and that was, should you start solid food before 6 months old? And the answer is always no, because the gut isn't fully matured, and what can happen is you can lead to an incredible amount of inflammation happening in and around the gut, leading to poor weight gain, bloody stools, a lot of abdominal cramping. Just like I wouldn't expect a small child to understand calculus, it's not an appropriate age to teach that level of mathematics. But once they're older, it's absolutely appropriate. And the same analogy applies to the gut. There's a reason why historically we haven't started solid foods before 6 months, because we're just not designed to do that. And there has to be time to allow the gut to mature to a full development at 6 months old before we introduce solid food. Now, with that said, there are a subset of population of kids, babies, that will benefit from this, but this is the exception and not the norm. These are the kids that are at really high risk for allergies, food allergies, and for severe eczema. And in those kids, we would want to start peanuts, eggs before 6 months old, because those are two of the highest risk allergen foods, the other ones being soy, gluten, and dairy. But eggs and peanuts are the ones that we focus on, and that was studied in the LEAP study. Again, nothing's absolute, so there is a subpopulation of kids that will benefit from taking high allergen foods before 6 months old, but this should not be a general recommendation for all of pediatrics. What's happening to the baby after they're born? So when they're inside mom in the amniotic sac, then that is a sterile environment for the most part. There are some microbes that are transferred from mom's gut into the amniotic fluid. This is early priming of the baby's immune system, but that is not considered a colonization by bacteria. It is essentially a sterile environment. Then when the baby comes out, I'm going to do this two ways. We're going to do first by vaginal delivery, and then we're going to do it by C-section, because that dramatically changes the path that the baby will be on in their gut development. So if we have a vaginal delivery and mom did not receive antibiotics during delivery, then the baby will be colonized with the bacteria that is coming from the vagina. This is predominantly lactobacillus. There will also be some bifidobacterium. And these bacteria are really important during that first week of life, because these are facultative anaerobes, which means that they can operate and create energy from oxygen or no oxygen environments. They prefer the no oxygen environments, but they will use oxygen. And there is some oxygen in the GI tract right after delivery. So these bacteria help remove that oxygen. They also decrease the pH so it becomes more acidic. And that has a protective effect, because some of the pathogens, some of the bad bugs that we don't want in the GI tract don't like this more acidic environment. They're basically preparing the GI tract for what would be the next level of development, which starts after the first week of life. Now, let's compare this to a mom who either received antibiotics and had a vaginal delivery, or the baby was born by C-section. In this case, either the bacteria in the vagina was altered because of the IV antibiotics that the mom received, or in the case of a C-section, the skin bacteria and the hospital bacteria will be the predominant bacteria that colonizes the baby's GI tract. And these bacteria don't lower the pH as well. These bacteria do not remove oxygen as fast. These bacteria cause more inflammation in the GI tract. They basically, if a baby's born this way, will prolong the preparation first stage and also set up an environment that makes it more likely for bad bacteria to find a place living in this baby's GI tract. Now that the baby's out, how are we feeding the baby? This is also hugely important. And we have breastfed babies and we have formula-fed babies. And again, I'm going to distinguish these two because it's very important. Breastfed baby will be provided secretory IgA from mom. The baby will be provided human milk oligosaccharides in addition to the nutrients that come through the breast milk. the importance of the secretory IgA is that these will help collect, if you want to call it that, some of the bacteria in the gut that's not supposed to be there. They help prime the immune system because the mom's immune system and the baby's immune system, they share 50% of the genetics. So there is just a natural benefit for the mom's immune system to be priming, not so much priming, but clearing the path of bad bacteria in a genetic environment that is very familiar. The human milk oligosaccharides also provide the nutrients that will help build the bifidobacterium population. The bifidobacterium will allow the acetate and the butyrate to be produced in the gut, and this helps build the mucosal membrane layer between the gut passage and the wall of the intestines. It also starts to feed the enterocytes, which are the gut cells, on the wall of the GI tract. So they're providing nutrient as well, which then helps the GI tract to finish its development. Because when a baby's born, the baby has leaky gut. The space between the gut cells, between the enterocytes, are basically open. It's like leaving a door open. So there is a passage which allows mom's nutrition to go in, which is the beneficial part. But if we have an environment that is unhealthy because of C-section or mom received IV antibiotics with a vaginal delivery, then that allows the pathogens that will cause inflammation or the nutrients that are not optimal, such as from formula, to pass into us proper through the wall and into the house. And then that causes more inflammation of the gut and will continue to slow down the march towards maturation. But it's really important that by having the butyrate, by having the acetate, by having the high levels of bifidobacterium, because mom is nursing and then the baby is receiving the human milk oligosaccharides, that helps those tight junctions between the enterocytes, between the gut cells, fully mature and create a barrier that prevents bad bacteria or inflammation from the inside of the GI tract into us proper. That's what happens in that second stage until 6 months old. And that's why we don't start solid foods before 6 months old, because we don't want those open doors allowing bad bacteria inside of us, allowing large food particles that we're not intended to see inside of us proper, because all of that increases inflammation in the immune system. And the majority of our immune system sits around the GI tract. So little inflammation goes a long way in terms of the whole body immune system being triggered. If the baby is on formula, then we have a situation where the baby is being provided seed oils. Seed oils, highly inflammatory, and these are passing through the leaky gut of the baby's gut and into the baby proper, and that is causing inflammation in the GI tract. So if we're looking at reducing inflammation so we don't have an increased risk for food allergens and we don't want to increase the risk for eczema, then we want to look at a vaginal delivery without IV antibiotics and breastfeed so we can allow the baby's GI tract to develop and mature normally without a high inflammation response because of either mom's diet, the formula, the IV antibiotics that were administered, or the soy or the seed oils that are in the baby formula. You can start to see how I'm going to move forward, because if there's a higher inflammation environment, then that means that there is a greater risk of having food allergens and having eczema. It's really important that we understand this distinction.